Hi, my name is Nicole Cavender with Aero Benefits Consulting. I wanted to put up an upbeat video about COVID because I really feel we're all a little tired of all of these regulation changes and all of the negatives. So I have noticed some positives in our industry that I wanted to share with all of you. And while they may seem small to some, for those of us working with benefits every day, they've made a big difference. The biggest difference that we've seen is the use of technology, not just from the level of technology for enrollment, which is nice because that helps us with, reducing contact with employees, but the use of technology by members to engage in their care. Prior to COVID, we had to fight to get people to use video visits or any kind of technology that the carriers offered to communicate and access care. So that's been a really great positive, and it's made for a much safer engagement with physicians. Another positive that we've seen is the flexibility we've all had to find a way to accommodate in our schedules. I have an office full of ladies that have children in school, and it's been a real challenge for them to manage their schedules. I had to find a way to be flexible. I don't want to replace these folks. I love my people. And so what we were able to do is manage use technology to manage our abilities to work, where and when we can, give people access to get work done and maybe find a way to work with the few hours that they find to fit in after the kids are done with school, work around those virtual learning schedules. The other place where technology, and I mentioned it a little bit earlier, was making a big difference was in enrollment. Oftentimes enrollment platforms were only made available to the larger employees that had a lot of people that they needed to enroll. Now we're finding, at least in our area, that smaller employers are now being given access to a level of service in a technology platform that we didn't quite have for little cost in most cases if you find the right partners.